Hi, friends and family. It has been a minute. It's been 6 months to be exact. This is another episode of our Real Talks. This is number 7. It's currently, what is the April?
29?
Or no, yeah, March 29th. And boy, we got a lot of updates over the last 6 months.
The 30th?
Yeah, I don't know anymore. But we have obviously had a lot going on over the last 6 months. We apologize that we haven't kept you more up to speed. Like everything, work and school and all the different medical appointments just have gotten away and we just haven't made time. But we're here now. We appreciate you guys. We love you and we want to kind of fill you in on everything that's going on. So it has almost been, crazily enough, a year since my craniotomy and the brain cancer tumor being retracted. And I am happy to tell you that I am a year in remission. In fact, I have been doing 3 months MRIs since then, and the prognosis has been so good that I'm moving to a 6-month MRI program with my oncology team. So again, thank you for the prayers and the good vibes and sending all of your energy and stuff to me. It's truly been amazing, and I am showing only positive results in that factor. So that is much appreciated. Boy, then it comes to the next thing that we have been dealing with, which is the Wilson's disease, which we talked a little bit about in the last video. We've got a whole lot more information and a lot more of what we're trying to do to kind of control that. Quick synopsis of that, if you weren't with us in the last video, Wilson's disease is a very rare recessive disease where both of your parents have to carry it, and ultimately what my body cannot do is process copper. And with that comes a lot of symptoms that either are through your GI system or your nervous system or both. In my case, I have a lot of them showing in the neurological side of it. And I just want to kind of give you an update of what we're doing to manage it and everything that we have done kind of leading up to now to kind of get a control of what the plans are and who we're working with, and and what we're going to do moving forward. So where to start?
Something good.
Something good.
Something good.
Oh, geez, let's see. So I have had, for the Wilson's disease specifically, several Doppler scans where they've looked at all of my blood vessels and stuff going down my legs, to kind of figure out if the edema had anything to do with any type of blood clots. I had an MRA done on my neck to make sure that there wasn't any blood clotting as well in the vessels that goes up into my brain. All of those came back positive in the sense that everything is clear there. I do have some narrowing, just genetically, of the blood vessels that goes into my head. That it's just a genetic thing that's smaller than most people's, but doesn't have anything to do with the symptoms that I'm seeing. What are my symptoms? Again, we talked a little bit about that the last time. They have gotten better, but they're still progressing. So I am still seeing signs of my hand tremors, and the headaches have gotten slowed down, but they're still moving forward in the sense that my symptoms are getting worse, but not as fast as they were getting worse when we last talked about this. So recently I got put with a UCSF team that's outside the oncologist that deals with rare disease. I worked with a gentleman named Dr. Gee, and he is a rare disease specialist and GI liver expert. And he had me do an ectoplasty, which is an MRI, a new way for them to look at your liver and your organs for signs of cirrhosis or damage, without actually having to do a liver biopsy.
Did we tell him about the biopsy?
Yeah, we did speak about the biopsy last time, and
Wiggle.
the biopsy obviously was a horrific experience. But this actually can do that without actually having to punch a hole in you, which is much appreciated and much easier to do to lay in an MRI tube than go through the biopsy, in my opinion. Any rate, the results of that were again in the positive. No signs of any type of major liver cirrhosis or liver damage or organ damage, which is very positive in the sense that the Wilson's disease hasn't caused major damaging to those organs, which just leads more to what we knew is that it's a lot of it's in my brain. And the symptoms all kind of line up with that. What else
That's
do we?
good for the tests.
Yeah.
Do you want to talk about the most recent appointment you had?
Yeah. So,
Just real quick. If you're going to have the exoplasty done, don't have it the same time as you're having your traditional MRI.
oh God, yeah. Jeez. So, I didn't know that
Separate the tests.
Yeah, I didn't know the ectoplasty was part of an MRI testing. So they scheduled it together on the same day. And so when I went in to have that test done, I didn't know that I would actually be in the MRI tube for literally an hour and 45 minutes. Both are done with and without contrast. So they started the brain piece of the MRI without contrast, and then they moved to the ectoplasty organ piece of it without contrast. And then they got to come in and give you the IV with the contrast. And then they got to finish the ectoplasty with contrast. And then because you already have that in your system, they go ahead and finish the brain portion of the MRI with contrast. And if you're familiar with doing MRIs specifically on your head and neck, they have to put this plate over your head that holds you in place and you can't move. So in order to do the ectoplasty piece of it, they also have this huge blanket that goes over your chest and organs. And then they have,
Paddle.
they have to compress it. So it has to be squeezed down really tight. And then there's a paddle that vibrates, and the vibration helps them see the organs. So you're trying to hold still while you got this thing also vibrate on you. And the fact that you're in there for an hour and 45 minutes without having to move, if you have any type of like nerve pain, like I already do from the neuropathy and the pinched nerve in my neck, and then obviously the pain that I've started to develop from the Wilson's disease, to be in there on your back, unable to move, in an MRI tube for an hour and 45 minutes, it's grueling. I actually didn't know if I was going to make it through that one. I had to tell the lady several times that I needed to get this thing done because I didn't know if I had much more in me to kind of grind it through. But yeah, separate those two tests. That's a very good point. But because of those two tests, the results came back that Dr. Gee wanted to put me with a neuro team with UCSF that specifically works with movement disorders. They're kind of the people that if you have Parkinson's, they're going to work with you to try to help develop care programs to manage, the neuro disease and its progression. And so I recently got connected with a team with UCSF that does exactly that. And they're one of the top movement and neuro teams within UCSF. The gentleman's name is Dr. Ian Bledsoe, if you ever want to look him up and want some, what I think is some of the best experience I've had thus far working towards a solution with the Wilson's disease. They were excellent, extremely thorough. We started off with obviously doing the typical neuro exam where they just check all of the different, see how you react through your hands and your feet and your arms and walking, your gait. And then they kind of did a diagnosis together, and then they came back in, and Dr. Ian Bledsoe wanted to record the whole thing to actually have that, not only for him to reference back to see if I'm getting better with the treatment, but he can also use that for future Wilson's disease patients, which I thought was kind of cool that I could be part of a program that maybe helps people with this rare disease in the future. Ultimately, I have pretty significant, which we knew, but we could at least document it, hand tremors to the point where it affects my handwriting. It affects my capability to do any type of really concentrated things with your hand, like holding a paintbrush, holding anything small in my hand and trying not to shake it. It really comes out when I focus in on those kind of things. To where I have resting hand tremors, where if I'm just sitting there not even paying attention, obviously the tremor line is pretty bad. So we're going to first work on, oddly enough, something pretty simple. I have to take blood pressure medication anyways, just because that's something that runs in the family, high blood pressure.
High blood pressure.
Yeah. So I take a blood pressure medicine called
bisoprolol.
She wrote it down phonetically for me. I still couldn't get it right. And so instead of adding new medications, we're just changing it to
propranolol.
Right, which propranolol, it actually has effects where it naturally helps with hand tremors, anxiety, which is a side of Wilson's disease. It has a function where it helps with headaches, which I didn't talk about that either. My headaches have not gotten better. It's a piece of Wilson's disease. Unfortunately, I have headaches 24/7. It's just the nature of the disease, and sometimes it can be as light as a tension headache to something that is as high as having to deal with a migraine headache. It's just every day, all the time, and it's just you learn to deal with it. But just hopefully switching to this new blood pressure medication, it's supposed to have benefits to anxiety, headaches, hand tremors. So we're hoping that just something like that is going to give me some relief and help. And then if that still doesn't get the results to a position where they're not progressing and we've got control of them or giving a little bit of relief, we're going to try to add in another medication called Topax, right. It does come with some other side effects that necessarily aren't good. Like they say that a lot of people that are on that might have situations where it affects you being able to put sentences together and or be able to forget some words. So there's some neurological side effects that can come with it. But the benefits of it is that it can tackle, again, the headaches, the
seizures mostly. It's that one is an anticonvulsant, so
yeah,
that should help a lot with the seizures.
Yeah,
which we think he's having some posturing, like with his hand. It'll be uncontrolled, and it's intermittent. It'll come on in the evenings, but this new doctor thinks that those are actually seizures.
Yeah, I think they're minor seizures that I'm having. So
if we have to go to the Topax, that'll help with the twitching and the
tremors. Yeah. So every once in a while, I start getting these weird, random arm twitches. It kind of looks like I'm trying to show my strong hand.
My strong hand. But, not quite a chicken wing, but almost a chicken wing.
But almost chicken wings out, and I can kind of control it by just holding onto my own arm and applying some slight pressure so that it doesn't do it without me having control of it. But it is a new development, and it is extremely annoying. But again, this medication, if we have to, can help control with those seizures, because I don't think we did talk about that. I did have...
Oh no, because that was December.
Yeah, that was December. So we actually have it on video through our security cams, where I was just sitting on the couch, and it was a very short, small event. To me, I don't remember.
5 seconds.
I don't remember any of it.
Maybe 10.
I remember just having the sensation that I needed to sit up, like I started to feel weird. And then we were just watching TV. I was sitting on the couch, Brittany was laying down on the other couch next to me, and then all I remember is her in my face asking me if I was okay, and I was just extremely confused because I couldn't comprehend how she just manifested from the couch to my face, because it was like, to me it was like that, and then she's just right here. And
You were out. You lost consciousness.
yeah, I lost consciousness. I fell back, making some weird noises,
It was
shaking.
really bizarre.
Only had one event of it, and I let my neurologist know with the cancer side effect. So I sent a message to my neurosurgeon and my oncologist, and then I sent a message to Dr. Gee, the rare disease specialist, and then my neuro team here in Las Vegas. The neuro team here in Las Vegas and the oncology team said that they didn't think it was anything to deal with the craniotomy or the cancer, because it happened so far after after the actual surgery. So they just said monitor it. Ironically, my new doctor with the UCSF team that seems to be more attuned to Wilson's disease did think that it is related to the Wilson's disease, and even thinks that might be what has started my weird chicken winging, and that he thinks that those are minor seizures that are happening. So again, going back to that medication may be something that I start taking to help with the weird muscle twitches that I can't control now with my arm. Again, hopefully this video goes out to people that have Wilson's disease. Search hashtag Wilson's disease or something like that, because it is so rare. I myself, I've been dealing with doctors now for over a year, and we're still not getting answers to everything. So this is challenging. If you are somebody that's in this, don't give up. You have to keep fighting, keep asking questions, just keep telling them everything that happens. Don't hold anything back. Even if you think it's a one-off, let them know everything, because even the smallest details might lead to answers to something else. For example, that little seizure leading to where I might possibly having tiny little seizures that, we might be able to control, because now we know about it and there's medication that helps with that. What else?
You're seeing the pain specialist.
Yeah. So,
Guess she's technically she's a therapist.
yeah,
But
you're going to feel overwhelmed. You're just gonna feel like you're a guinea pig.
dragged through the mud.
Yeah, it's just such a rare disease that,
And you feel like shit.
you do feel like shit. The disease it naturally makes you feel like shit. That's just the only way to put it. So you're going to mentally be challenged in this, and so through our couples therapy, she recommended that I start my own therapy to deal with this, and it was the right decision to do. And I am in a 10-week program that specifically works with people that deal with chronic pain and deal with having medical conditions that really stresses you out mentally as well, because besides the physical aspect of it that you have to put through this, you have to remember that the mental piece of it is just as difficult and is just as challenging.
You got to find that strength.
Yeah. So the program is extremely tough because it makes you have to face it mentally as well. Like you deal with it physically and you kind of naturally charge your way through it. That's just always been my personality, right? Like they teach you that in the Marine Corps, that no matter how much it hurts, you just continue taking that next step, and that's just what you do. Well, this makes you recognize that you're doing that, and that maybe that's not the best case, and that maybe you should learn to pace yourself, and that it's okay to say, hey, I don't feel like doing this, or to recognize that your body says, hey, slow down, stop, maybe don't do as much as you're used to doing so that you don't burn out. And you have to face your morality. You have to understand that, you it's okay to ask for help. And so, yeah, I'm doing that along with all the other doctor visits. Definitely recommend it. I know
Yeah.
it doesn't sound easy, but
She teaches you different approaches and how to manage how you feel about the pain and how you feel about the disease. Right?
yeah. It's all positive, and it's recognizing that
It's work.
chronic pain is a cycle, and how to break that cycle, how to use distraction to pull yourself out of circumstances, whether that's music,
Taking a walk.
taking small walks, and as she calls it, being present in those walks, not walking mindful, not being there to think, okay, I got to walk 10 minutes and looking at your clock and just being worried about when 10 minutes is up. Walking and trying to enjoy that walk, being aware of, it sounds stupid, but those simple things like, smell the roses type of thing, but it's the truth of it.
Yeah.
So I'm in mental health programs. I'm working with rare disease specialists, and now a really amazing neuro team with movement disorders. The cancer's in control and remission.
Yep.
It's been a crazy 6 months since last we talked, but I feel like we've accomplished a lot in those 6 months.
We got a plan.
Yeah, we've got a plan.
This is the direction we're going.
Yep. Yeah.
We did lose Ziggy Kitty.
Oh yeah, man. So
it was just a couple days, maybe a week
after our last video. So yeah, I think last time we talked, Ziggy was the old man, and boy, the old man decided it was time. It wasn't that much longer, but sure do miss him.
Yeah.
Him and Marie.
Yeah.
We've decided that we're probably not going to get any pets until we can kind of get Brittany through school and
maybe then just a goldfish.
Start small.
Oh,
but we're going to get her through school, which she's doing well. She's almost through her second to last semester.
One more.
Yeah, August. Mm-hmm. August is around the corner, so we're
coming.
Ready for her to get that done.
Yep.
What else can we tell you guys? Outside that, we're doing good. We're taking it day by day. Still enjoying being out here in Vegas. We're appreciative to everybody that's continuing to check in and send texts and send their love on social media. And again, you guys are a wealth of strength behind us that keeps us moving.
I figured out how to get him to eat, though.
Oh, yeah.
We've been trying those moonshines with the snacks, like pickles and pineapple and shit. He loves the pickle moonshine.
Yeah.
So I'm like, well, I'm just going to soak everything in moonshine. That's the trick.
Don't tell my Wilson's neuro team.
Oh, yeah.
Yeah, if they had it their way, I would be zero.
But
here's to him. It's just Russian water.
So hydrating. Oh, the zinc, y'all.
Oh, God, yeah, I guess we got nothing.
So he has to take the zinc because it chelates the copper.
The copper, yep.
Unfortunately, and I didn't think about it at all, but extremely high doses of zinc and a zinc deficiency, believe it or not, can cause anemia. So his labs came back and we were just checking on the computer, and his hemoglobin is 9. His hematocrit's like 25%. Red blood cells and white blood cells counts are low. So it's got to be from the zinc.
Yeah. So
we'll have to tackle that now.
Which also makes me feel like I'm not completely crazy, because
the fatigue.
Yeah, I've been extremely fatigued, and I've been having bouts of when I stand up, feeling like I'm gonna almost pass out, like gray out and see the stars, and Which now we know that that's probably has a lot to do with just the unfortunate anemia, which is related to having to take the copious amounts of zinc,
Yeah.
which looking at some of the blood work, my doctor is not yet convinced that I still might have to take some heavier
Yeah. The penicillamine.
chelation for the copper just because of
He referred to it as a cat in a bag. Like,
Yeah.
we cannot let this get out. We have to control it, and we have to stay on top of it.
Yeah, he said the Wilson's disease, he says, unfortunately, it's one of those diseases like I saw just over this last year, when it gets to the level that it's at now, when it is out of control, it turns into a wildfire really quickly, and the symptoms progress very quickly. So he says we have to make sure that, like she just said, that we can't let that cat out. We have to keep it in control.
Yeah.
So if I start to show any signs of it moving the wrong direction, he's like, you have to let me know immediately. We can't let it get 2-3 months down the road. Otherwise we lose control of it. And it's one of those diseases that once the symptoms progress, you can stop that progression again, but you can't get it backwards.
Yeah.
So every time it gets worse, I'm stuck with that progression going forward and worse. So we can't do that. So really sticking to the diet,
Yes.
really sticking to taking my pills every day and not missing that. And
Speaking of the diet, we had direct proof that the diet does affect
Oh, yeah.
how you're feeling. One of our favorite spots, y'all, it's been a shitty year. One of our favorite spots to eat, they were like Second Family, the bistro, they closed. So we went for the final night,
yeah,
and he decided that he's got some really nice wine at his shop. So we were having some red wine, and he shouldn't have, but he did, and he felt like shit.
yeah. It wasn't the wine flu. It was
No.
definitely related to just going outside my diet
Yeah.
and my body just absolutely rejecting the copper deposit that came with just drinking red wine all night at the place. And it wasn't like I had a glass of wine.
Yeah.
I shared a bottle or two with the owner, and my headaches and my tremors and everything was so much worse for several days before
Yeah, started to calm down.
started to get that back out my system again. And so
stick to the diet.
stick to the diet.
It's working. You might not feel like it is, but it's
Yeah,
working.
but it definitely comes into play. So just reinforce that this is just a life-changing situation. But
Yeah.
gosh, we're already at 27 minutes. So
Yeah, I think we kind of covered everything.
I think we got it all done. Yeah, I can't think of anything else. Like anything, if you guys have questions, obviously reach out to us on our social media pages or ask anything down in the comments below.
Do you check the comments?
I do, yeah, I get emails.
He runs the little channel thingy. So.
Yeah, I see your guys' comments and stuff if you have any. Obviously, we're not nowhere near viral, so it's easy for me to answer the one or two
Yeah.
comment questions that you guys have. But yeah, we just wanted to put this out there again. It's easier to do this and keep everybody informed versus trying to call everybody, or God forbid you hear it through word of mouth, and sometimes that doesn't always get translated the best. So we figure this is the best way to keep you in the loop.
It's better than 25, 30-minute phone calls.
Yeah, exactly. And if you are somebody like me that just happens to stumble across our video that is struggling or just found out you have Wilson's disease, I am more than happy to answer any questions or at least speak to my understanding of it that I've gone through thus far over the last, it's been almost a year
Just
now.
about, almost,
Yeah. So, and all the doctors, don't give up. You're
Yeah.
gonna feel like I said, you just so much blood draws, so many different doctors are going to talk to you. You're gonna feel like no one really has an answer, and they don't. I mean, it's so rare that there are resources, but there are not very many.
Yeah. We can try to put you in touch with the right people. At
Yeah,
least.
yeah.
Get you on the path.
Yeah, for sure.
Yeah.
All right, guys. Again, this is number 7, Real Talks.
Yeah.
Brain cancer is in remission. Can't believe it. That's awesome. That's a positive. Wilson's disease, getting the hang of it. Love you guys. Until the next one, which promise won't be 6 months. We'll try to do this
Yeah.
a little better.
Well, we'll tell you about the screw on the
Oh
on the
God.
next.
Yeah.
Or do you want to tell them now? It's 30 minutes.
Yeah. It's
Leave them hanging.
We'll leave them hanging.
We'll tell you about the screw in the next video.
Let's just say I can honestly say I've got a loose screw.
Legit. I mean, we all knew it.
We all knew it.
Bye, guys.
Love you.
Bye.
Bye.